Did you know that hypertension or high blood pressure can be a silent killer? Did you know that many lifestyle factors, such as what we eat, whether or not we exercise, the amount of salt we use, these things can all contribute to hypertension? It's true in most cases, high blood pressure can creep up on us without any symptoms, and the root causes of that condition are often things that we're totally unaware of. However, high blood pressure is coming to us with staggering complications. High blood pressure contributes to things like heart attack, to stroke, to kidney failure, and to blindness. Perhaps most sobering is just how common high blood pressure is. If you look at individuals in the United States in the 30s and into their early 40s, roughly about 16% of them, roughly 1 in 7, have high blood pressure. If you get into your 50s and 60s, that figure jumps up to above half the population, and by the time we're in our 70s, it's about 3/4 of Americans that have hypertension, synonymous with high blood pressure. I'm Dr. David DeRose, your host for the program called Lower Hypertension Naturally. It's part of the LifeStart seminars, and it's something that can help you once and for all actually take charge of that high blood pressure. Now, some of you might be saying, well, this sounds too good to be true. Everybody in my family has high blood pressure. Or you say, well, I'm not really concerned about my blood pressure. Yes, it's high, but I'm going through a lot of stress right now, and I can't eat very well, and I can't exercise. I'm on the road a lot, and I'm sure once I get on a better lifestyle, it'll all take care of itself. Listen, it's true. There are genetic and early life history factors that can predispose you to high blood pressure. Yes, it is true that short-term lifestyle things can affect blood pressure, but here's the point. If your blood pressure is running, now listen carefully, if your blood pressure is running above 110/70, the evidence suggests you're increasing your risk of cardiovascular complications. That is, if you're not taking medications. Now, why I say it that way is if you're taking drugs, we don't want to get your blood pressure down that low. The side effects of the drugs will increase your risk of problems more so than any benefits of getting the blood pressure down below, say, 135/85. But the lower we can get our blood pressure naturally, the lower we can decrease our risk. The more we can decrease our risk, or the lower our risk of things like stroke and heart attack. Like I said, down to as low as 110/70. Here's the message where I'm going with this. High blood pressure is dangerous. If your blood pressure is running high for 2 years, and you say it's all going to be better 2 years from now, listen, you can still have a stroke during these 2 years. You say, well, Dr. DeRose, my blood pressure is only 140/85. The doctor said that's not high enough to go on drugs. By the way, I agree with that. But getting the blood pressure lower with natural agents is even more powerful than just waiting, because it can further decrease the toll that high blood pressure is taking on your body. So if you want a program that takes advantage of some of the latest medical science has to offer, as far as giving you tools to naturally lower your blood pressure, I want to recommend to you Lower Hypertension Naturally. Go to LifeStartSeminars.com, sign up for the program, jump in, and just check and see what happens. You'll find, as I mentioned in that presentation, the principles are so powerful that you'll want to check with your physician if you're on medications before you start in that journey. Again, it's all there free of charge at LifeStartSeminars.com. I'm Dr. DeRose, and I'm looking forward to seeing you there.